All right, let's move to a major issue, perhaps the only major issue that the two of you disagree on markedly, healthcare. The pandemic has brought into high relief our healthcare system. And when it comes to the insurance side of that system, Mr. Conole, I'll start with you on this question. We know that candidate Balter supports Medicare for all. She'll have a chance to talk about how she sees that in a moment. You have a chance now to explain why you do not support Medicare for all, and since you don't, what would you do with the healthcare system in America?
Well, I'll tell you, Dan, since we launched this campaign, we have been talking about healthcare as one of the #1 crises that we confront. And I believe that it is our generation's crisis to face and to solve. Everywhere you go in the district, healthcare is a major concern, and it's personal. It's personal for almost everyone, even in my own family. My father worked in healthcare his entire career. He retired when he was almost 69 years old. My mother was 7 years younger than him, and they had that realization where they realized that she was going to be gapped coverage before she was eligible for Medicare. They examined plans. The costs were astronomical. Now, fortunately, my father is a retired colonel in the Army Reserves, and he was able to buy into TRICARE, which is essentially a public option that is afforded to retired military. Every Central New Yorker, every American should have that type of option. So the approach that I advocate for and that I believe in is that first, I think that we need to continue to work to strengthen Obamacare and the Affordable Care Act, but we also need a robust public option, a Medicare type public option that Central New Yorkers can buy into and work on controlling the cost of prescription drugs.
All right, candidate Dana Balter, your position, please, on Medicare for all.
Listen, I don't want to keep Central and Western New Yorkers trapped in a broken system, which is where we are now. Obviously, we need to protect and strengthen the ACA. John Katko, Donald Trump, and the Republican Party have been engaged in sabotage of the ACA for years now, and it's putting coverage for tens of millions of people at risk, and we've got to deal with that. That's only step one, and Mr. Conole's plan doesn't go far enough. It will still leave 10 million Americans uninsured, and I'm sorry, but that's just not good enough. That plan won't help the man in Williamson that I talked to who can't go to the doctor because his deductible is $4,500. It won't help the union worker in Syracuse who's on strike because in order to cover his family, he has to pay $5.97 an hour out of his wages just for the premiums in his health care. That is not an acceptable system. And the good news is we know how to fix this. There is so much research that tells us that if we give everybody access to the Medicare system, which works, which is popular, which is the most efficient health insurance program in the world, we can solve this problem. Everyone will have access to care. 95% of households will pay less money. And there is a way to make this change gradually and thoughtfully. Let's start by lowering the age of eligibility from 65 to 55. Let's offer a public buy-in so people of any age who want to participate can. Let's enroll babies when they're born so that from day one of life, you are guaranteed coverage. As we expand the roles, we give more competition to private insurance so people who still have private insurance get better services at better rates. This is the way we can get everyone covered in our country.
Well, let's go around on this again. Mr. Conole, that sounds like she's got the plan, Medicare for all, and a way to go about it gradually. What's the downside of that, in your opinion? Why not go all the way instead of just tinkering with the ACA and of allowing for a public option to go? Give me the downside in 60 seconds of her explanation of Medicare for all.
Well, I will tell you this, Dan, having grown up in Central New York, I know that you're not going to make progress ordering Central New Yorkers into a plan. What my plan does is it trusts Central New Yorkers to make their own decisions about their own health care. I think it's a much better approach that we can galvanize Central New Yorkers behind. And then if Central New Yorkers want Medicare, they could buy into Medicare. And I think it's a much more achievable approach. And if they're on their plans, they could keep their plans. I've talked to union workers across Central New York. I've talked to teachers. I've talked to nurses, many of whom say, would like to keep my plan. Well, they can do that. with my approach. However, if they would like to buy in to a public option, they could do that as well.
Dana Balter, why not? Just a public option. Why do you go all the way on this one?
Because as I said, the public option alone does not fix the problems with the private insurance market. And in no way is my plan forcing anybody to do anything. It leaves room for private insurance so that if you want more than what Medicare offers, you can go to the private market to get it. I too have had conversations with people all across this district, including union folks who support Medicare for all. If you divide employment and insurance, then people who are in unions don't have to use their negotiating power to fight for this basic right of healthcare. They can instead use their negotiating power on better wages and conditions and all of the other things that matter to them. We should be guaranteeing access to everybody in this country. This plan has been studied and it has been demonstrated to save money for the overall economy for 97% of households and to guarantee universal coverage. Mr. Conole,
I want to give each 30 more seconds to make your best case for your health plan. Candidate Conole, why do what you would do with the ACA and the public option?
Well, no, again, Dan, what I will continue to say is that healthcare is an absolute crisis. And I think that the public option is going to go a long way to address this crisis. It's going to allow everyone the option to buy in to a Medicare-like plan. At the same time, we're going to work to control costs of the Affordable Care Act. The big difference here is that I trust Central New Yorkers to make decisions about their health care. And I think that is I know Central New Yorkers, and I will tell you that is the best approach that will work throughout our region. 30
seconds for Dana Balter. Why does yours work better? You would enroll everybody at birth because it's kind of like the mandate under Obamacare. If everybody's not in, it won't work?
I would do that because we want to get care to everybody. The goal is to get everyone covered. And that is a way that we can expand the roles without changing what people are doing, without forcing anyone to give up things that they like. Again, the plan that Mr. Conole is talking about leaves 10 million uninsured. It doesn't finish the job. We need to get everybody coverage. And I want to do it in a way that also saves this country trillions of dollars in expenses, saves households thousands of dollars a year in expenses, and makes sure that nobody ever has the threat of bankruptcy, and they can see the doctor and take their medications. This is the plan that does that.
Thank you. We got to take a break because we need to reset and come back with questions on the economy, police reform, and more with the candidates in the 24th District Congressional Democratic primary. Don't go away. We'll be right back.